Now we are seeing about meningitis and the various infectious causes of encephalitis. Now we'll move on to demyelinating diseases. So demyelinating diseases, as the name suggests, myelin is going to be lost. Myelin is needed for nerve conduction. So without that, the patient is going in for lots of trouble. So the best example of demyelinating disease will be a multiple sclerosis. Multiple sclerosis is an autoimmune condition, and basically it is a type 4 hypersensitivity, Th1 mediated hypersensitivity reaction, due to which there is going to be absence of myelin. So myelin is all being destroyed. So it will lead to a demyelinating condition. So type 4 hypersensitivity, remember that, and it is having certain HLA association, especially HLA-DR2. Other than that, interleukin 2 receptor and interleukin 7 receptor polymorphisms are also associated with multiple sclerosis. So usually the patients will present with unilateral blindness. So there is going to be optic nerve involvement leading to optic neuritis. So because of that, the patient is going to have unilateral blindness. Then rest, it can also involve other brainstem structures, various cranial nerves also, and spinal cord also. Because of that, the patient can go in for respiratory failure and arrest also. Okay. Grossly, if you see, the brain is going to have lots of sclerotic plaques. So these plaques are kind of characteristic for multiple sclerosis. But to prove that there is no myelin, to document that it is a demyelinating disorder, you need to put a special stain called as Luxol blue or Luxol phos blue stain. So Luxol phos blue will stain myelin, but in multiple sclerosis, that area alone is going to appear pale. The rest of the areas will be highlighted by blue colored of the myelin, while that area which is undergoing plaque is going to appear pale. Then on CSF, we have a specific finding called as IgG oligoclonal bands. So oligoclonal bands are normally not seen. So IgG oligoclonal bands are seen in multiple sclerosis. CSF IgG levels will also be elevated. So other demyelinating disease will be Devick's disease, which is also called as neuromyelitis optica. Okay, I'm not going into the details. There in Devick's disease, it's actually aquaporin genes which is going to be defective.